Okay, Whip World's back again. So, where I left off at, speaking with Kingdom Morons and anyone else who is interested in this, you go on to say in that video that the rate of Medicare cost is much lower, government is much more efficient, and you go on to quote a writing by a paper done by Jacob Hacker. You said it was from MIT. From what I found, he's at Berkeley, and the paper was done out of Yale. I'm not sure on that though, but that's just splitting hairs. And get this cat out of the way real quick. So Jacob Hacker's study on said that Medicare pays 80%. You quoted 81, but let's just say 80%. They pay 80% of the cost, and you're absolutely right. Stand corrected. I do stand corrected, but there's a clause in there. And when I went to go speak with a doctor, and he was an orthopedic surgeon, and his PA was with him, and instantly they busted out this book, CBT 2008. This is an old copy, and they just gave this to me. It's current procedural terminology, and basically it's every procedure that they do there, and it's basically just the procedures and the nomenclature associated with that. So when they type it into the here's my little notes here. When they type it into the program they have, it would say it's the leg got ripped off from a car accident or something. And the procedure that they quoted was 27876 whatever. But the doctor said it's a 3-hour procedure, right? And their cost, what the doctor charges, is $2,700 for that procedure. Now, the allowable amount in that spreadsheet, we went through Aetna, Cigna, Blue Cross and Blue Shield, and went through all those, and they're a little lower for that coverage. They were allowed to bargain for a little lower price on that, but they went to full Medicaid or full Medicare, and the allowable cost by Medicare was $992. So that's roughly a third of the total cost. See, what Medicare does is that they set the price. They don't bargain at all. They say this is how much this is worth, and this is all you're going to get. So the 4-hour procedure was almost $3,000, and the other health insurance providers were going like $2,800. Just a couple hundred. They're knocking a couple $100 off through bargaining. But Medicare mandates. They don't bargain. They mandate. That's going to be less than $1,000, period. And the 80% that Jacob Hacker quoted is right, because Medicare mandates this procedure is only worth $1,000, and the 80% is they cover 80% of that $1,000, and the patient kicks in the other 20%. So on the whole of all these in that book there, of all those procedures that they do, Medicare only covers roughly 30% of the cost of all those procedures. And there are some procedures that they totally will deny. They straight up deny. They will not pay for it. And he went on to say that if this bill goes through, that you have to keep in mind that the doctor they pay $250,000 a year in malpractice premiums, right? And they still pay for their their PAs, the lights of the building, everything they pay for, and then they get reimbursed. And I think if you do like 10 or 15 of those a week, not say you do 10 or 50 surgeries a week, but if you keep on that level, you're just straight up. Anyways, the doctor says, I'm not going to work for peanuts. if this bill goes through, I'm not going to work for peanuts. I'm not going to work for free. It'll take me about a little over 4 years to pay off all my loans from medical school, which is about $300,000, and a residency, which is between 4 to 6 years that you pretty much work for free. And you have to take out more loans to cover your cost of living during that time as well. He said, after he pays off all his loans, he's going to, if this passes, he's going to quit. So, yeah, that was just him, though. So, I don't know how that's going to work out. But I think I covered just about everything. Oh, yeah, you said, you told me to ask the doctors how they feel about, dealing with insurance companies and the staff it takes to bargain and argue with them. He said that's a piece of cake, because they will bargain with you. The staff that we have to keep on hand to run a fine-tooth comb through all the little snippets and loopholes that they can try to find in the Medicare package to try to eke out every dollar that they can it's very arduous, and they literally have to keep a staff just for that too. So but Medicare does not bargain with them. And another thing is that it also said that Medicaid pays 3 cents on the dollar on average. So that's even more worthless. That's a proper terminology for it. So I'm going to cut it short once again and come back to finish up.